So we have a service moment that I'm going to talk about today, and I'll just tell you in advance, this is going to be a tough one to get through. So I'm going to read it, otherwise I will forget something important. Today's Spirit Shout Out is one of the most amazing stories of teamwork that I've ever heard since I came to the hospital center 5 years ago. It touches the lives of two patients, one very tiny, and includes elements of outstanding clinical care, a safety finding, and an above all patient-first moment that truly shows what our teams will do for the people in our care. On September 8th, and this is something that many of you may have seen on the news, in an unimaginable instance of domestic violence, Andrea Grenage Parks was burned over 70% of her body, and she was 34 weeks pregnant. Both the burn center and the NICU teams had arrived in MedStar by the time she was wheeled through the door. The OB team arrived moments later. On initial assessment, Dr. Shupp determined that, based on her extensive burns, she had less than a 10% chance of survival. To give her every possible chance, he had to give her massive amounts of resuscitative fluids, but this would be impossible until the baby was delivered. Initial sonogram could not pick up a fetal heart tone. Dr. Shupp explained, if we had found fetal heart tones, we could have gone to the operating room, but we had to deliver the baby right then and there in MedStar. Everything was incredibly urgent. And our teams did exactly what they are trained to do. The OB team, led by Dr. Amy Lee and Dr. Maggie Burke, performed the C-section within minutes. The NICU team, led by Dr. Mehmet Bayraktar, known affectionately around the hospital as Dr. Bay, quickly stabilized the infant girl and rushed her to the NICU. The burn team then took Ms. Grenage Parks to the opposite end of the hospital, to the burn intensive care unit on 4H. During the next 48 hours, she received a massive 20-liter burn shock resuscitation. Burn shock is extremely lethal and must be treated aggressively. She remained in very critical condition, and at this point, her survival was in question. In the NICU, however, the team was pleased to see that the baby girl was responding to her care. But emotionally, it was difficult, knowing that the mother's life hung on the balance. That gave NICU nurse Teresa Dupree an idea. There is a tradition in the NICU, which started with Yolanda King from social work. When it becomes clear that a baby in the NICU will not live, the nurses record the baby's heartbeat on a disc and put it inside a Build-A-Bear for the parents to keep forever. For Miss Grenage Parks' baby, they decided to do this in reverse. Nursing supervisor Pat McKay bought the bear, and Jackie Bell Benton, nursing director of the NICU, spoke gently and thoughtfully to Miss Grenage Parks to explain what they wanted to do. Jackie says that even though it wasn't clear that the patient could hear her, she felt it was important to tell her exactly what they were doing. Together, Jackie and the nurses from the burn team captured the mother's heartbeat from her exposed foot, and the NICU team put it into a specially dressed Build-A-Bear, which they then put near the baby girl while she recovered. And she would have her mother's heartbeat forever, regardless of the outcome. Yet, amazingly, with the great care that was provided by the team, she began to respond. She faced several significant hurdles during her time in the ICU, requiring surgery and constant monitoring and expert care from her physicians, nurses, techs, rehab therapists, dietitians, and pharmacists. And because she had little of her own skin available for grafting, we were given special permission to use a technique called CEA, or cultured epithelial autograft, which is only approved by the FDA in compassionate cases like this. Our team took biopsies of her skin and sent them to grow in a lab in Boston. Eventually, Dr. Shupp and the burn and third floor OR teams were able to cover her burns in just 2 operations. And she continued to get better. When she became well enough, she was transferred to 3E, although I'm told the 4H nurses had become so attached, the change was harder for them than it was for the patient. Her baby girl, now appropriately named Journey, had already been discharged home. And on November 6th, 2 months after this horrible ordeal began, Andrea Grenage Parks also went home and was able to hold Journey for the first time. The story doesn't end there, of course. She continues to come back to the burn center for care and rehab, and she has a long road ahead of her to full recovery. But her family is beginning to speak out about domestic violence, and she would like to share her story to help others sometime in the future when she is ready. For now, we have learned something important too. Dr. Lee, the obstetrician who delivered Journey, realized later that Miss Grenache Parks had been coming to our clinic for prenatal care. A common question that is asked of all expectant mothers is if they feel safe at home. After experiencing this case, Dr. Lee says it has raised the team's awareness and they have made changes to their approach when asking this question. More people now ask the question. It's worded differently each time and is asked more often, opening the door to greater conversations to be able to try to recognize this before something like this happens. Dr. Lee also said one other thing, that in situations like this one, our teams do what they have to do for our patients. It is only later that the gravity of the patient's condition sinks in, and that's when she is very grateful to be part of such an incredible group of providers. We are also very grateful to this entire team. We are a huge hospital, we are incredibly busy, and the patients we care for have very complex cases. But we never seem to lose sight of the fact that each patient is a human being in need of empathy and compassion, and we have that in great supply. Please join me in this special spirit shout out to the physicians, nurses, techs, social workers, physical and occupational therapists, dietitians, pharmacists, and others from the burn center, obstetrics, the neonatal ICU, the third floor OR, who all played an important role in saving the life of Andrea Grenache Park and her daughter, Journey. Down. Great job, team. Great job, great job, great job, great job. Great leader, great leader. Again, just a great example of the teamwork that we see at the hospital center every day. It's amazing.